All right. Good morning, everyone, and afternoon, good evening, and thank you for joining this global health webinar. Today's topic, we're going to be discussing physical activity training for healthcare providers. We're going to start with two esteemed countries, EIM Singapore team and our EIM Chile team. We're going to discuss their efforts to provide physical activity training to healthcare providers. We'll get started with short presentations from each group, but really the goal today is to just generate discussions on what's going on around the world and how different countries are trying to provide this training through online or in-person efforts. So you're not here to hear me talk, so I'm going to introduce our first group from Singapore, and I believe Miss Ivy, you're going to get us started, correct?
Dr. Ng will start first.
Oh, I'm sorry. Okay, Dr. Ng, please.
Okay, thanks, Mark. Let me just share my screen. Okay, thanks, Mark. On behalf of EIM Singapore, right, I'd like to thank Global EIM and ACSM for giving us this opportunity to share our training experiences for these EIM courses. And maybe I will just give an overview first before we proceed. This talk will be presented into two parts. The first part will be by myself, where I'll just give an overview of the courses that have been done over the years. And the second part will be presented by my colleague, Ms. Ivy Ng, who will be talking about how EIM courses are rolled out in Singapore administratively. So let's get started. So maybe just a brief history of EIM. EIM was launched in Singapore. Singapore's chapter began on the 15th of July 2011. And so we are kind of like approaching our 10-year anniversary. So we've been running EIM courses since the beginning. And one of the key goals when we started out was it's kind of like synonymous with the goal of EIM Global, which is to call upon doctors to prescribe physical activity and not to refer their patients to a certified fitness or healthcare professional to get their exercise prescription carried out or supervised. So quickly, training and education became a key role because we found that there were certain barriers that would present itself in order to achieve these initiative goals. So generally in Singapore, right, we've been conducting two different types of courses. One for the doctors and another one which is distinct for the allied health professionals and fitness professionals, which include nurses, dietitian, trainers, coaches, as well as exercise physiologists. So the rationale for having these two types of courses will be discussed because each group has its own goals and learning needs. So we conducted a survey back in 2011 among doctors. This is right before we rolled out our training courses. And this is to get an idea of how many doctors in Singapore kind of like prescribe physical activity to their patients. And what we found was maybe about 20% of doctors do prescribe exercise or talk about exercise to their patients in an office visit. And some of the reasons that they gave, I mean, amongst all, I mean, the top of it would be time constraints. But a very close second would be that they have insufficient knowledge, or they were not confident in being able to prescribe exercise to their patients or find ways that can help their patients to be more physically active. And it's no surprise because doctors, probably in Singapore and across the world, are kind of like not taught how to prescribe physical activity during their medical school education. So in addition to that, right, what we also found surveying the ground was that healthcare providers doctors generally are not sure how to identify qualified fitness professionals to work with their patients to carry out exercise prescriptions. because of their lack of knowledge on their educational levels and certification in the field of exercise science. Of course, there's also concerns of malpractice. And in Singapore, the training for fitness professionals is quite heterogeneous. But what's evident was that we felt that there was a lack of training programs for allied health and fitness professionals that specifically target exercise supervision for chronic disease. So here I'll just show you the overview of these two different distinct causes and what we teach and how they differ but yet complement each other. So for the EIM Singapore doctors course, we essentially teach mostly the basic tools and principles of for exercise prescription, how to do a pre-participation screening, providing medical clearance for patients with chronic disease to begin exercise. And I think one of the key things that we also teach will be how to counsel patients and find ways for them to be more active. And ultimately, right, to write a prescription for the patients with various chronic diseases. So the conditions that we talk about for exercise prescriptions are the usual: hypertension, heart disease, diabetes, obesity, asthma, and as what is listed here. So the training for the allied health and fitness professionals, they do carry similar topics and headings, but generally they are geared towards exercise programming, which means that if they had received a prescription or clearance from a physician, and they've been, or if the physician has referred a patient to them, how are they going to interpret the prescription and how they go about programming the exercise program session within the parameters of the exercise prescription and some safety precautions. So a lot of the teaching is spent on talking about understanding the pathophysiology of the disease, chronic diseases that's mentioned as listed here, and how exercise can be carried out safely. So a lot of it involves kind of like exercise supervision, how to monitor your patients, how to track them for improvements, and also how to troubleshoot. And we still teach important skills such as like blood pressure monitoring during exercise, blood sugar control, or blood sugar monitoring during exercise. And we talk about some common musculoskeletal injuries and how these fitness professionals can help modify the exercise program with such patients. And another key issue that we do cover for the allied health professionals course would be how to communicate with healthcare providers. That's one of the issues that the fitness professionals face on the ground. How can I refer my patients? Which doctor should I refer them for example, exercise clearance? Let's say if I have a patient who I'm supervising for chronic disease, how do I go about troubleshooting and subsequently get further medical advice from the appropriate physicians? So communication skills would be quite important as well. So the way we delivered our EIMS course would be in 5 different segments. Of course, usually once they're signed up, we do send them reading materials. We actually have an official course book. Then of course, there'll be lectures, interactive case studies. Also some gym time where we encourage our doctors and fitness professionals to know how is it like to exercise, or how is it like to supervise patients with chronic disease. These are all pre-pandemic. So we'll talk about how we have switched it to during the pandemic and after, currently. Now, of course, what's unique to the course is that there is a written assessment at the end of the courses. So generally, we run the course over 2 days, and we give them time to kind of like revise, ask questions. So the next few slides are just like photos on how we have EIMS in action during teaching courses. So this is like a big group. I think this was Dr. Ben teaching a group of fitness professionals in Taiwan. All right, so it's a big group, and in a small group class setting, maybe about no more than 20, we usually conduct it. So you can see some of the participants dealing with lectures, discussing case studies. The idea was to try to make it as interactive as possible. And this is the segment where we go to the gym, and every course has a gym session where here you can see doctors trying out how is it like to maybe do a squat, maybe like kind of like exercise to see how it feels. Because a lot of, surprisingly, a lot of the doctors are also quite exercise naive. So in order to be able to walk the talk, they probably have to know how is it like when they exercise. So these are some photos that highlight also some important skills. So you can see trainers teaching the fitness professionals how to do a proper sugar monitoring, how to monitor and measure blood pressure. So these are just some skills that we teach during the course. And of course, they are considered EIM certified if they have attended the course and also successfully passed the written assessment. There's just some happy faces who have passed. So the written examination is actually an MCQ paper. So we kind of like cover what we teach, and there is a designated passing point. The passing mark, the passing rate is not always 100%. So there will be, unfortunately, failures. But the numbers are small, and we actually allow them to retake the exam with different paper up to 2 attempts. And once they have passed the exam, the validity of the certification is 3 years, after which they are required to come back for a recertification process, which is also embedded in one of the course program. So moving on with COVID, there was a short break during COVID where we did a hard reset, and we figured on we had a discussion on how to make the course pandemic proof. So moving on, I think at least for now in Singapore, right, moving your courses online will be the way to go. Fortunately, Singapore still allow gatherings of no more than 8. So whilst we were able to deliver the teaching online, we still did the assessments, the MCQ paper on site. So here you can see 7, so no more than 8 happy faces with masks. So this is one of those courses that we have recently concluded. So till date, right, since the beginning, we have these numbers. So we have locally about 907 EIM certified physicians, and about 595 EIM fitness professionals. And we actually log these names and certified individuals into our website. So it kind of like forms a search engine where you can kind of like look for EIM doctor or look for EIM fitness professional. So let's say if I'm a doctor and I want to refer my patient to somebody who I feel can help my patient exercise safely, then that's the place to go. These numbers are just local, but over the course of the last 8 to 9 years, we actually have conducted training courses across Asia. EIM Singapore also doubles up as Asia's regional center. So yeah, we have conducted multiple training courses all over Asia, just like Qatar, Malaysia, even Taiwan. And we have helped some of our colleagues like in Japan, Korea, and Philippines set up EIM centers and given them some best practice on how to move on with their training courses. Because each country is quite unique, and no 2 countries can have the same program. So we should encourage people to adapt accordingly to their local situation. So key challenges. I mean, over the last 10 years, what we found, some key challenges for countries who are keen to kind of like develop their training program or move on would be these things that I listed. Of course, these things I will not elaborate too much, but be key issues for discussion, I believe. So funding and manpower, content development. So we are fortunate because ACSM has allowed us to use and adapt their content according to our local guidelines. Maintaining a steady pool of teaching faculty according to standards required, and forming partnerships with local stakeholders, whether it's public or private, to kind of like push these training education courses across different platforms. And these are just some organizations that we have worked with over the years. I think the next phase of it is we're trying to, we will be rolling our training and education courses into medical universities. So undergraduate medical school training will be in the future, will incorporate exercise prescription based on our EIM training programs as well. So with that, I think I will stop share. Maybe pass the presentation to my esteemed colleague Ivy to maybe continue.
Thank you, Dr. Ng. Okay, I will continue from this part. Let me share my slides. Okay, thank you, Dr. Ng, for your presentation, and hello to everyone. My name is Ivy, and I'm the Secretariat for EIM Singapore. I'll be bringing you through the journey of a typical course planning process. In EIM Singapore, we are supported by 4 broad pillars, namely training and education, public outreach, research, and community programs. For today, I will just zoom into the training and education arm to cover the administration part and share on how we can easily plan and conduct a course. Under the training and education arm, based on the EIM solution, we have created a health ecosystem where we have doctors and healthcare providers like nurses, like healthcare professionals and fitness professionals. With the different backgrounds and experiences from everyone, we run 2 parallel courses to cater for this ecosystem. One is for primary care physicians and one for allied healthcare and fitness professionals. This ensures everyone are trained to speak the same language and able to provide the best treatment plans for their patients and clients to be referred within the physical activity network. Generally, we start the planning process a year ahead to identify the courses for the Education Director's approval, whom in Singapore is Dr. Ng Chong Sian. It is important to start planning ahead as we need time to plan out the course dates, identify the right lectures and from our teaching faculty, block out clinicians' time, and work out the course budgets. In a year, we usually run a total of 12 courses, usually once a month, with 5 courses dedicated to primary care physicians and specialists, 2 to Sing Health Family Medicine residents, which they are the biggest healthcare cluster in Singapore, and 5 to allied healthcare and fitness professionals. For our primary care physician course, they are usually done over 2 Saturday afternoons to ensure high attendance rate, since most of the doctors run clinics on weekdays. On the contrary, courses for allied healthcare and fitness professionals are deliberately planned on weekdays, as their workload are less busy. Our course and assessment are previously done in a classroom setting. However, with the COVID situation, we have adjusted to the new norms by conducting our lectures and teaching online, followed with a face-to-face written assessment as mentioned by Dr. Ng just now. And it will be not then, the class size will be not more than 8. On top of this, we will also plan the course to be in conjunction of major conferences that will be happening in the year. This will enable us to reach out to more people who are attending the conference, as well as providing a special course fees or perks to the participants. For example, just 2 weeks ago, we just ran an exercise prescription course for our fitness trainers in conjunction with our first inaugural Sport and Exercise Medicine Conference in Singapore, where we offered free conference passes to the course participants. Many had expressed their appreciation as they had indeed gotten additional in-depth learning on top of their newly acquired skill. As for our course fees, it differs for both courses due to man hours invested. For our doctor's course, learners typically require 9 to 10 hours as they would already have clinical knowledge. Thus, it's easier for them to grasp the content. For our courses to the allied healthcare and fitness professionals, it will usually take about 16 hours as it might be the first time that one will be in contact with more clinical information. To help our participants in their course fees, we had recently worked with National Trade Union Congress in Singapore to have our courses endorsed by them. And with this, our participants will be able to enjoy special course subsidies to lighten their financial load. This support system differs in every country, and I urge all of you to explore the different possibilities in your home country. Next, we will first commence our marketing efforts to create awareness for our courses on our EIMS website, Facebook, and quarterly newsletter. These are some samples of marketing materials on our own platform. This is for the website. This is on our Facebook page. In addition to our marketing efforts, we would also work with our SingHealth partners to send EDM of the courses and also run event booths when we are invited for community talks. Videos of the EIM solution would be screened and informative take-ons would be given to the visitors at the booth. In this way, indirectly, we would also be able to target the general population exercise prescription and create a demand for our courses. Next, as part of the collaboration, we'll work with the administrators from the SingHealth Family Medicine Residence Arm. Information will also be cascaded down to them so that they can share the information to the respective doctors. For paid advertisement, we purchase advertising spaces on newsletter from the Singapore Medical Association, where they distribute the printed newsletter to most of the GP's clinic in Singapore. The e-version of the newsletter will also be placed on their website. Since the newsletter are really meant for doctors, this proves to be an effective avenue to reach them. This is the ad will look like. Now, the exciting part is to track the responses. For responses, I usually create an simple Excel tracker to monitor the inquiries, and it solves. The closing date for all registration usually ends 1 month before the commencement of each course. Upon receiving the interest from potential learners, I will proceed with the registration process by asking learners to submit their personal particulars via email. Upon the closing of the registration, I will send an email confirmation to the course learners, as well as requesting for payment via online banking. The course materials will then be snail mailed to them for pre-reading prior to the commencement of the course. This is also the last step. This is also the last step for the pre-course preparation. Fast forward to the course. In the current setting, I will usually open the virtual doors 15 minutes before the actual commencement time, where I will share on the administrative information, like reminding everyone to switch on their cameras during the virtual lesson, switch on their mics, and as well as giving out a pre-course quiz that we have set for the participant as a warm-up to the course. Thereafter, the course director usually start the course with an icebreaker introduction before proceeding to the first lecture, while I remain at the backstage to support in other administrative duties like virtual breakout rooms for case study and other discussion, etc. This will remain so till the end of the whole course duration. Second part of this course would be the written assessment, where we conduct it personally. In EIM Singapore, our assessment paper consists of 50 MCQs, and they are required to be completed within an hour. Marking of the assessment will be done on the spot, and certificates to the course will be done at the same time too. Upon finalization of the assessment, I will list the information of the learners on our EIMS website, so the interested parties will be able to contact them for exercise prescription needs. Last and the final step for the administration process consists of sending participants a post-course survey, where they provide feedbacks on the course content, follow which I will present the results to the education faculty, where we do constant evaluation on our courses to maintain the quality and standard that we have set up. With this, I end my presentation. Thank you for your time.
All right, thank you very much, EIM Singapore. I have a lot of questions, and Anna, I want to explore your question, but let's first go to Sandra from EIM Chile, who is also the regional director of EIM Latin America. Let's go her presentation, then we can open it up for some comments and questions with everybody. So go ahead, Sandra, please.
Thanks, Mark. I think you are seeing my screen. Just confirm to me, Mark, please.
Yes, we can see it. Yeah.
Okay, thank you very much. So thank you very much, Mark, for the invitation, and congratulations to Singapore for this wonderful job. I'm glad I talk after you because you are the rich part of this team. We are the poor side of the exercise in medicine here in Latin America. So I just want to share with you what we have done in the last years, probably the most important things in our region, and especially focus on the exercise in medicine online courses that we launched last year. So so part of the things we have done in the region, I think the most important ones were due to Dr. John Duperley, that starts with exercise in medicine. I think it was in 2010 in Colombia. And he started with his team a huge number of courses in the region from 2011 until 2015. They reached almost 3,000, more than 3,000 physicians, and with health professionals, they took over 5,000 health professionals in the region, almost 17 countries. At least half of these were in Colombia. And he organized a course similar that Singapore showed. So it was an 8-hour course with a theoretical and practical part, and they took almost all the measures you have seen, and body composition and aerobic power and strength and flexibility. And it was a lot of fun also with these groups of physicians around the region. When we started I think in Chile, we started the courses with this same model in 2012, as well as Argentina, Mexico, Dominican Republic. I think they were the main countries in the region that organized the courses: Mexico, Argentina, and Dominican Republic. I'm glad that Jorge Francala is here with us. He can share later the experience in Argentina. And particularly in Chile, we started in 2015 when I arrived in the country. For those who doesn't know me, I'm from Colombia, but I work in Brazil for almost 25 years, and then I moved to Chile 7 years ago. So since then, we are organizing the courses. In 2015, that was our first course for official course. We invited Dr. Robert Salis to be with us in the launching of our second course in Chile. And then we try to organize at least 1 to 2 times per year with the support of one university in Santiago and one university outside Santiago in Viña del Mar. This is almost 1.5 hours from the capital of the country. We have also the support of the Sports Medicine Chilean Society that gave us the opportunity to reach more health professionals. During 2019, we also took the opportunity to be in Dominican Republic that they organized, and it happened so frequently in our countries that we organize exercises medicine inside some huge events like this. That was an International Congress of Nutritional Therapy, and this is our key speakers, Dr. Francala from Argentina, that he's leading the exercises medicine courses across Argentina, and Dr. Richard Marin, that he has a wonderful team taking care of all the Caribbean region. He organized more than 20 or 30 courses in the last 5 years across the Caribbean. and Central America. And this is a wonderful experience we had in Aruba in August 2019 with Dr. John DePerle, with Rudy Lesner supporting our actions in Aruba. And it was the first time we have a simultaneous course, one room in Spanish and one room in English. It was amazing. It was so incredible experience to share during one day, two rooms at the same time with two different teachers, but with same content, one in English and one in Spanish. And also, it was the last thing we did after the pandemic. Actually, it was at the time of the pandemic almost. It was in San Francisco Rincon in Mexico. It is a small, very, very, very small and poor city in Mexico. And I want to show this picture because it was, as we started the course in an open space, we were freezing. It was winter, we were freezing. It was an open space with no communities at all. And we have the dogs and chickens walking around. It was amazing. It was so nice. And one day I think we have to write a book about the backstage of these courses we did in Latin America. And the last one was 1 week later in Medellin in Colombia, that we organized also with a sports nutrition team in Medellin. And we had also scheduled one for August 2020. And of course, this course didn't happen. And we are still waiting for some moment to organize this in present. This is a special course we are organizing inside a post-graduation program on sports nutrition in a university in León in Mexico. So we decided to launch our online exercise medicine workshops. Actually, this is not a consequence only of the pandemic, because I started to borrowing Mark and everybody in the region many years ago. I think I started in 2016, thinking about having a model that were able to be launched without too many funds, because all these courses were wonderful, but they cost at least $10,000 to $20,000 per course. So it was impossible to keep this kind of courses. And many of them happened because we had the support of private industry, and we don't have more this support. So we started in 2017 the proposals. I started the recording process of these courses in July 2018. Where I received the material from Exercise Medicine Global Center. We start the process of translation into Spanish, and we record all the classes on July 2018. And finally, after the pandemic, we decided to launch the courses on May 2020. If you enter into the Exercises Medicine website, you will see our regional centers, and you have this access in Exercises Medicine Latin America. You are sent to our Spanish page of website of the Exercises Medicine, and in this we have the highlight of our online main Exercises Medicine course. We are also spreading out the course through the physical activity networks in the region, the Latin American region physical activity network. And when you enter in our website, you will see like this. This is the model of our website of our clinic. We are in a sports medicine clinic in Santiago de Chile. It's one of the most amazing sports medicine clinics in Latin America, and I think in the world. It's amazing. We have 8 sports medicine centers in Chile. The purpose of the course is the same. We keep all the material as we receive from Exercises Medicine. We keep everything like this, just translate it into Spanish. We had 2 physicians talking in the course. That is Dr. Claudia Perez, that is very well known in Chile, and a sports physician, and me. And we took just 3 models of the course. The first one, the health benefits, the safety screening and prescribing physical activity, and also the introduction part that Exercises Medicine had for these sessions, that is around 15 minutes. And as we had the update of the physical activity recommendations in 2018, we recorded a new version of this, putting all these new recommendations in 2018. And this year we also put a supplement of one class about the effects of more related to myokines and health effects and health benefits for this exercise and physical activity. So now you have around 8-hour course, and the professionals took around 4 weeks to complete the course. We put in the Google Classroom because we don't have funds to do this, so we use a Google Classroom, and it's very well organized, all the material, the introduction, the benefits, the screening and the prescription. We have a welcome also, and in the welcome session we have a video that we recorded when Dr. Salis were in Chile some years ago. So this is available to everybody to see what is the purpose of exercise medicine. In this we also put a program, and in this program we summarize the purpose of the course, and we emphasize that the material was developed for American College of Sports Medicine, and that this is not a course about a specialization on prescribing exercise, and also that this is not a course of updating exercise physiology. So we give them the right purpose of the course that we already know. We put also the calendar with the sessions, the dates, and the times of the classes during these 4 weeks. We put around 20 minutes per day. So all the sessions or the classes are divided in sessions or no more than 20 minutes, and we put at least 1 session per day. And in the end of each model, we have a self-evaluation. And at the end, we have the online test that was also developed by Exercises Medicine Global Center. In this, you can see the way you see the platform, and we have also an active break. And in this active break, we put an exercise medicine video that we developed in order to spread out the message of exercise medicine, the message that they can spread with their patients, and it's a way of having them also doing some activity or not to be seated all the time during the course. We also include a kind of set or reference that we think they will help them to complete the knowledge. So we suggest some lectures, and we divide according to the topic. And we also include in some cases the link to the reference. We do not put the PDF because we have a copyright problems. So we also just put the reference, and in the case we put also the support or the link to Exercises Medicine support material that is available on the Exercises Medicine website. And as I told you at the end, we developed this. We put out, I think, 5 to 10 questions per model at the end, just true or false, in order just to keep them aware of the things that we want them to learn at the end of the classes. And we have the possibility of know how many of them are returning the self-evaluation, are delivering the evaluations and the classes. And at the end, we have also final message of Dr. Robert Salis, that is also a video that we recorded with him talking to the patient, is using the exercises medicine purpose, but for the patient. It's just a 2-minute video that is also available for the professionals. And all of them at the end, if they see the 100% of the hours of the course and they reach at least 80% of approval in the final evaluation using the same question Exercises Medicine Global Center developed, they receive a digital certification saying if they approved with this or they just took part in case they don't approve the final test. So this is the way we are sending the certifications at the end. This is the way that we organized the 3 courses in 2020. We organized in October 2020. We had around 14 countries. 74% the participants were from Chile, and we had around 500 professionals just last year online. This was impossible to have in presential courses. We had around 40 to 50 participants per course, no more than that. So reaching almost 500 for us were just amazing. And also we had an evaluation from a test that we performed an evaluation about the classes, the topics, the platform, the quality of the videos, the quality of the information, the duration of the session, the quality of the PPT. And we have all around 4.8 in evaluation from 0 to 5 in these last courses. And we included this year, we started this week on Monday, we started the courses for 2021. We are scheduling 4 courses for this year. We already have more than 200 people doing the course that started, as I told you, last Monday. We have 7 countries. And for the first time, we are including the whole National Center of Exercise Medicine Colombia. That is our new partner in the region. And we also offer them by free 34 physicians of the host institution of Exercises Medicine Colombia. So this is a way you can include also national centers and host institutions to know what we are talking about with Exercises Medicine. So I'm glad to have you on board. I'm sorry, Mark, you were not in this picture because you have to be in that one, but I would like to thank the support of you and the Exercises Medicine team, because this is a dream. This is a work team, and this is the only way we can do things in our region. Thank you very much.
Fantastic, thank you, and thank you, Singapore. Sandra, you talk about a poor country and rich country, but I don't think that's a presentation of a poor country at all. That looks absolutely fantastic, so thank you. Let's go to some discussion and questions. Anna, you threw up the first one. Let me bring it out and discuss that a little further. Chung, when EIM Singapore started, I know you used to have your exercise professionals being trained at the same time, maybe not the same room as the healthcare providers. Are you still trying to do that? Because I think you were trying to have some synergy across the groups. Can you comment on that?
Yeah, initially we felt that if they were next to each other, then there will be more enhanced learning, so they can learn off one another. But over the years, I think scheduling a course where you can get doctors and trainers together in a same place is challenging. Because, for example, the typical work day for doctors, is usually the weekdays, and most of them can spare time to enroll for some CME training on Saturdays, for example, after their busy afternoon Saturday clinics. Whereas the trainers tend to be quite busy over the weekend because all their clients will take off and go for their PT sessions after work. So we found that, the trainers generally prefer to have their courses done on the weekday when they're not so busy. Whereas the doctors generally they prefer the weekends. So yeah, by and large, we find it very hard to put them in the same place. So because of that, we now even run doctors courses and fitness professional courses on alternate months. So let's say in January, we are holding a doctor's course, then maybe in Feb, we'll run a fitness professionals course. So that will give us enough room to maneuver teaching faculty and adequate sign-ups.
Awesome, good.
But each country is different, I suppose. So just that this is quite, I guess it's quite unique to the Singapore situation. Yeah.
Oh, thank you.
I would like to comment on this, Mark, because here we have almost this challenge, because when John Duperli started the courses in Latin America, the courses were just for health professionals and especially for physicians. But when I arrived in Chile and I visited many countries around the region, I realized that our physical fitness professional or physical exercise professionals are very different from country to country, and most of them are so focused on exercise prescription and fitness and no knowledge about exercise and health or physical activity and health benefits. So at that time we decided to include them in our courses, and I think we have more a fitness profession and exercise profession and exercise medicine courses than physicians and health professionals. So you have almost 60% to 40%, and they really appreciate the course, not only because of the exercise prescription for them is too basic, but the other part, the screening process and the health benefits for fitness, health, and mortality, this is so useful for them. So I think we should include them in these courses also.
Yeah, maybe I would like to add to that, because one of the challenges that we have in identifying suitable course participants for fitness professionals is that we try to come up with some minimum requirements, because the nature of training professionals in Singapore generally is quite heterogeneous. So we have some requirements. Maybe Ivy, you want to share with us what our eligibility criteria for our fitness professionals to join the EIM training?
Okay, so for fitness professionals, right, first I will screen them. So basically they have to must have at least a diploma in any courses. Then at the same time, they must have this AED or like life-saving kind of cert. And lastly, we need them to have a fitness professional cert. So it can be a cert, can be a ACSM cert. As long as they are certified, they have studied like sports science, that we will be able to accept them.
Yeah, I remember Dr. Ben and I way back when having debates about whether they should be trained together or separately. I don't think there's a right answer or wrong. It looks like Singapore has moved to separately. That's what I always thought. I thought separately, but maybe interacting a little bit. Sandra, if it's working together, that's awesome. I mean, the important thing is we're getting the message out there and connecting these people. So I have a question for the two of you, Chung and Sandra. Both of you referred primarily to doctors in your training. What about the training of other health professionals like nurses? There's almost more nurses in the field in primary care. They're taking on larger roles. Is there any thought to reaching out to that segment and training them to help the doctors in the clinic setting?
I can start. Actually, our course of fitness professionals, initially we targeted the fitness professionals, but over the last 5 to 6 years, we actually rename our training course of fitness professionals to allied health and fitness professionals. So generally, that includes nurses, dietitian, pharmacists, exercise physiologists or coaches, or even teachers who may have an interest in chronic disease management for using exercise. So in fact, we have actually conducted specific training programs for nurses specifically. So one of the training groups that we conducted were the group of nurses who worked in the National Dialysis Center. So basically, these are nurse managers who run the community or neighborhood kidney dialysis centers for end-stage renal patients. And there they learn how to give exercise counseling, maybe teach the patients on ways how to be more active and perform some simple exercise. So we have done that, and every now and then we do get sign-ups and requests from nurses. So the allied health course actually has expanded to various groups. I forgot to mention, even we also conducted training courses for specific groups of dietitians who, whilst counseling patients on how to eat healthy, they also want to throw in some exercise advice. So that has also been done before. So it's very select group, very targeted in terms of being more inclusive than exclusive. Yeah.
Well, for us has been too difficult to reach this group. Our health professionals are more related to physical therapists, I think are the most common in our courses, and some nutritionists, but nurses, I think we didn't have anyone. I can't remember one of them. It has been very difficult, but I think I agree with you, Mark, and this is a group we have to reach, and it's one of the challenges for this year, at least in Chile. We will try to get this group some way, somehow. I don't know how, but we will try.
Awesome. Jorge, did you have something you wanted to say? I think you're on mute, Jorge.
Thank you. I want to congratulate all of you, and especially Sandra. I know the way she's working hard in our country. It's real. The economical position of each country, it's a real question, and the way she managed is smart enough and clever enough, and with the effort to reach all these people. So I understand two things at a time. This is a challenge, I understand. One of them is to propose that in the courses should be regional, because we have to adapt to our own countries. I understand that we can talk about medical doctors, fitness, and as Sandra told, if we have the proper content, we can talk to the whole group at a time sometimes. The second would be to try to mention at the beginning of the course what ACSM means and the reference, because I understand that I have found many people in the courses that after finishing this, they are not in the knowledge of what ACSM means, and ACSM is the main source of all this course worldwide. So I understand that perhaps it is important to add at the beginning of the course or at the ending of the course something mention ACSM, and also to belong to ACSM. I understand the language would be sometimes difficult, but we are now starting in the next Health and Fitness Summit 4 lectures in Spanish language to try to promote this in our language. Perhaps in Singapore or any other country it would be possible. And also with the contents, because we will talk about the algorithm, and sometimes in our countries in Latin America we can't use the same algorithm ACSM proposed, but when you find in the guidelines for exercise testing and prescription, ACSM explain why they can work with this algorithm, which is a little different from the rest of Latin America. So I understand he has mentioned, I am pointing him as if he were looking at me, but he talked about key at the last part of the lecture and talk about content development. I understand that it would be great to work. Some things would be together, the same and the main. Some of them regional, and then we can share or have this specialized, and some of them in a group. So I think we have many axes to work together, but especially to position ACSM as the mention of the source of the knowledge and exercise medicine program.
Thank you, Jorge. Appreciate your comment. So it looks like we're coming up on the end of the hour, and I'll tell you, we're working on something in the U.S. that there wasn't time to share today. Anna, I'd love to hear more on what's going on in your plans in Poland, Upal, what you're doing in Sri Lanka. So our next EIM Global webinar is actually going to be on advocacy. And I'm going to have the ACSM chief advocates who works at Capitol Hill come in and talk about how he approaches political advocacy. But maybe the one after that, we can return to this topic because I think it's very important. A lot of people are doing stuff. And as you can see today, we filled an hour just talking about 2 countries, one country and one region. And honestly, I learned a lot today. So Chung, Sandra, Ivy, thank you so much for presenting, for sharing. The rest of you, thank you so much for being part of this. Let's keep this conversation going. It's absolutely fantastic work. So thank you, everybody. And with that, I'm going to stop the recording.